Master's in Athletic Training program, and we have one of our students, Jacob Cole. He's going to talk to you today about diagnostic ultrasound and how it relates to stress fractures in high school athletes. So, without further ado, I'm going to turn it over to Jacob and let him go.
Good afternoon, everybody. My name is Jacob Cole, and I'm going to be talking about utilizing diagnostic ultrasound to diagnose stress fractures in adolescent athletes. So a little introduction into stress fractures. Stress fractures in adolescent athletes is common. It's caused by repetitive stress, and it's most common in sports with high impact and high intensity training. So most common sports would be track and field, running, things of that nature. And then in overhead sports, we have things like baseball, swimming, and rowers. Stress fractures are important because they can disrupt training a great deal. This is because they're kind of hard to diagnose, which can lengthen the recovery times. Current imaging techniques for stress fractures are the X-ray and the MRI. You'd have to do them in that order. An X-ray is not very good at detecting early stage stress fractures. And the MRI, which is considered the gold standard, is very good at detecting stress fractures, but it's costly and time consuming to do. This represents the need for an alternative diagnostic tool. This tool would have to be quick, cost effective, and provide an accurate assessment. Which leads me into diagnostic ultrasound. So diagnostic ultrasound has been shown to be a promising tool to do this. It's non-invasive, provides a real-time image, it's portable, and it's cost-effective. This would make it particularly useful in the sports setting by providing a rapid and accurate diagnosis. The effectiveness of ultrasound in providing these diagnoses is still under investigation, and diagnostic ultrasound is currently used in sports already to evaluate musculoskeletal injuries such as ligaments, tendons, and other soft tissue injuries. So the purpose of my research was to assess ultrasound imaging's diagnostic accuracy and its effectiveness in early stage stress fractures. We wanted to see if it was able to monitor the healing process and then evaluate its potential for enhancing outcomes. So here's a little clinical scenario for you guys. We have a 17-year-old football lineman. He presents with pain in his foot. He continues to play with this pain in his foot, and 2 weeks later, he says, I can't do it anymore, and we get an X-ray and it shows he has 2 fractures in his 3rd and 4th metatarsal. This causes a 5-week recovery from that date, resulting in 7 weeks away from his senior year of football. My focused clinical question reads as, in adolescent athletes, does utilizing diagnostic ultrasound when compared to a standard clinical exam improve the prognosis of the injury? And it's broken down on the screen there. My search strategy for this research was to use GemFinder and SportStatisticus. My inclusion and exclusion criteria consisted of it must include a diagnosis of a stress fracture using diagnostic ultrasound. It must be more recent than 2015, and it must be written in the English language. For my quality assessment, I used QuadAS and STAR and the quality appraisal checklist for case series studies. The reason that these last 3 studies do not have a checklist is because they are narrative reviews. Narrative reviews and the case series are considered low level of evidence. We'll get into that later. And then systematic review is a high level of evidence. So the results of my research showed that diagnostic ultrasound can detect a stress fracture. It's most effective in stress fractures in the tibia, metatarsals, and the ribs. The tibia and the metatarsals, which is the shin and the foot, have the highest rate of stress fractures. The sensitivity of MRI is comparable to the sensitivity of diagnostic ultrasound in the lower extremity. Sensitivity is the ability of the test to say that you don't have the injury. So the statistics would be 80 to 100% for sensitivity, and specificity, which is the ability to say that you do have the injury, ranges from 53 to 79%. It's also been shown to be effective in adolescents where risk is higher. The advantages of diagnostic ultrasound, as I said earlier, it's cost effective and it's efficient and it's accessible. It's less expensive than an MRI, so if we want to talk about numbers, MRI of a foot before insurance costs roughly $4,500. This unit that you see in the picture can cost anywhere between $3,000 to $4,000, and then every year you have to pay a service fee of $200 to $300. So if you use this once, you're already cheaper than an MRI. Diagnostic ultrasound can also provide a real-time dynamic assessment, so you can look at it while it's moving, which an X-ray and MRI you can't do. And then also you have the ability to do something called sonopalpation, which you can create your picture like that on the screen, and you're able to touch on the body exactly what you're looking at and see what's going on underneath. It can also allows the ability to track the healing process, so you can look at it every week if you wanted to make sure it's doing okay. And it's also useful in diagnosis of other musculoskeletal injuries, as mentioned before. And then the limitations of diagnostic ultrasound. So the most important one up there is it relies heavily on the skill of the clinician. It's less effective for visualizing deep bone structures. This is important because the severity of a stress fracture is determined by how deep it goes. So you're unable to tell using diagnostic ultrasound. You'd have to use an MRI for that. It requires the proper training and some more numbers. This logo here is for the Medical Management Technical Institute. They offer a 3-day course, costs $1,000, and they can train you to do this. Another thing that limits the results of this is the topic lacks a sufficient amount of evidence. So if we go back to my sources used, I only have one level or high level of evidence, and that is just because there's not a lot out there yet. The clinical bottom line. So ultrasound is an effective tool for early stress fracture diagnosis. It can detect a stress fracture before an X-ray. Its benefits for being inexpensive, quick, and accurate. It provides the ability to track the healing process by repeat exams, and you also have, since it has high sensitivity and a low specificity, it should not be used to replace MRI, but instead should be used with MRI. So implications in athletic training. As I said earlier, it should be used as a tool to rule out stress fractures, not rule in stress fractures, due to its high sensitivity and specificity. So if you have an athlete who you suspect has a stress fracture, and you use diagnostic ultrasound and it says that they do not have a stress fracture, you can pretty reliably say that they don't. If it says that they do have a stress fracture, that diagnosis would need to be confirmed by an MRI. But you can treat it in the time leading up to the MRI as a stress fracture, decreasing the time to return to play, which goes into the multifaceted approach of using MRI as well. And then diagnostic ultrasound can improve the early diagnosis, monitoring, and prognosis of stress fractures in adolescent athletes. So if we go back to our clinical scenario, he was out for 7 weeks. This was mostly due to the stress fracture progressing into a complete fracture. Diagnostic ultrasound, if used, could have shown early signs of a stress fracture when he first had his pain in his foot, cutting out the recovery time of a complete fracture, resulting in roughly 3 to 4 weeks of recovery, which would allow him to play 3 to 4 more games his senior year. Here are my references. And I would like to thank the JSU Student Symposium for allowing me the opportunity to speak, and then my cohort, my professor, and my family for supporting me throughout my graduate program. Does anybody have any questions?
They already asked, but I'll ask again. Anybody have any questions?
Yes. So, a stress fracture you would treat very similar to a normal broken bone. It's mainly just a lot of rest. It's caused by the repetitive stress, and basically you would just remove the stress.
Well, no more questions, another round of applause.